Hey guys, today I'm going to be doing my peer teach over the rapid response team. I saw this called 3 times when I was on the specialty unit, and it was really pretty cool. At first I thought it was a code blue, and I kind of got excited because I'd never seen a code blue before, but quickly found out it wasn't a code blue, and my nurse told me it was the rapid response team. So I had never heard of it before, so maybe some of y'all had never heard of it before. And that's why I'm doing my peer teach over it. So I'm going to put you all down here so you can see the slides better. So the rapid response team, what it is, they are there to assess and manage acute clinical deterioration in patients. So this is when the patient is deteriorating, but they are not yet at a code. So this step is called before a code blue. And giving this patient that early intervention improves the patient's outcomes and reduces mortality rate. So when the rapid response team is called, there are triggers for activation, and these are typically physiological reasons. So this could be things such as a low blood pressure, a low heart rate, or a rapid heart rate, or low oxygen saturation, or even lab values that don't look right. These are all things that could be reasons to call the rapid response team. And each institution has their own criteria as to when they want you to activate the rapid response team. It varies from hospital to hospital. So some institutions use a worried or concerned criteria, and that is based on nurse intuition. So if a nurse feels like something is not right, then they can go ahead and call the rapid response team, even though vital signs may not show that anything's wrong. They can still go ahead and call them. Some institutions even have a patient and family activation process. Of course, I believe that this could cause some problems because this could increase the number of calls for the RRT. That could overwhelm the staff, and activating that, they could activate that when there is no clinical deterioration in the patient and they're just worried about them. So that could cause some problems, but again, I don't think many hospitals use this option, but some do. So who's involved in the rapid response team and what the process is? So there is the primary nurse, a critical care nurse, a nursing supervisor, the respiratory therapist, a pharmacist, and the provider. So the primary nurse is important because they can give information to the rapid response team. They can give information such as the code status of the patient and other important patient history, such as diagnostic test results or medications that the patient's on, stuff like that. The critical care nurse, they are responsible for leading the initial and ongoing assessment. And when the provider is not there, they are also in charge of initiating approved protocols for that nurse. This can be things such as oxygen, giving medications, an ECG, lab specimens, stuff like that. They're also there to call the provider when the patient gets to a state that they need to see them. So again, that's only when the provider isn't there. The nursing supervisor, they are there to arrange transfer of patient to a higher level of care if that's necessary after the call. They're also there to initiate interventions and help with documentation. Overall, they are there for support. And the respiratory therapist, of course, is there for the respiratory assessment and basic airway management. Now, the pharmacist, again, with who's involved in this process, that varies from institution to institution as well. So, some hospitals do have a pharmacist there on every call, and some don't. But the pharmacist is there to give you knowledge over medications and dosages, stuff like that. And provider, I would have thought they would have always been there, but they are not. Again, that varies from each hospital. Some hospitals have the provider there for every single call, but some only have them available as needed. So the benefits of the rapid response team, one is that this can make the nurses more comfortable. Not every hospital has a rapid response team, but they're using it more and more. So I personally would feel a lot more comfortable having that rapid response team on hand if I needed to reach out to them. Number 2 and 3, decreases the mortality rate and decreases the amount of ICU admission. And it overall gives the patient better outcomes and gives them better care to have that and give them that immediate intervention. Can mean a world of the difference. So these are my references, and if y'all have any questions, leave a comment.